I'm Russ Gould. I'm the prostate cancer director at Wellness Place, and also involved with US2 International, which is a support group for prostate cancer patients. I'm probably most importantly a 13-year survivor with advanced cancer and still treating it all the time.
My name is Rudy Lombard. I'm an 8-year survivor as of this year, April Fool's Day. And I'm a research associate at the Robert H. Lurie Cancer Center in the Department of Medical Social Sciences.
In my case with the radiation, and this is most often true, there is no problem other than urgency. Now, the urgency is you think you got to go so bad that you're going to die, and you really don't, but that's the way it is. So you get to know where every bathroom and every store and everywhere you go is. And that's one of the ways you deal with it for a little while, and knowing that that's going to go away. Okay, now it's more serious and a little bit more involved for guys with say, for example, surgery. They might have to deal with a catheter, and, oh, I got to wear this bag. Well, again, most of the guys that do that say, don't worry about it, it's no big deal. And that's usually short-lived. When I'm talking to people, I want to make sure that they really understand this incontinence issue, because long-term, this is a quality of life issue and problem. And oftentimes they are not told, and the doctors don't explain enough. So the first thing is you've got to make sure you understand everything you can about the potential for incontinence. Guys will talk about almost anything, and until I can get them going, they don't mention incontinence. But boy, there's a very high percentage that have it.
But I don't see anybody getting around that issue. And as Ross said, when you get into the habit of being a survivor, you can almost figure out how much time you got before another urgency. My urologist says, go before you need to go. Go before the urgency comes, and if you do that, it's helpful. But you get used to expecting to go to the bathroom a lot more than is normal.
One of the most important things that I've seen myself from learning, but I tell other people, is that you do have some control over this. Now, the first thing is Rudy mentioned, the most important thing is find out what's causing it and where it is. And there are many things, and you treat them all, deal with them differently. One of them is here. And most people don't realize that. We've proven it. It's in your mind. The trouble is we don't know how to turn the valve on and off. But if you know that, and if you pay attention to it yourself, you'll learn. How many times have you said, if I don't go to the bathroom, I think I'm going to die? And somebody gets your attention, and next thing you know is, it's been an hour. I haven't been to the bathroom.
There's also issues of diet. I mean, if you're going to be worried about, whether you have urinary frequency, you can't eat hot peppers. You can't drink a whole lot of alcohol. Maybe some people say you shouldn't eat tomatoes or citrus, fruit and so forth, so on. And I think that helps as part of a regime of trying to confront this issue.
There are things that can be done as simple as put a little pad in your underwear. People say, what do I do about this? And all the way from get some from your wife, the little thin ones, or there's all kinds of other ones. And those things, one of the things that they do is it builds confidence. I don't have to worry about this. So there's all these things you can do about it.